Hear my prayer in silence before thee as I ask for courage each day.
Throughout history, some of the greatest innovations to medicine have been born on the battlefield. Examples include the development of systems for managing mass casualties utilized in hospital emergency protocols and the early application of tourniquets. With that in mind, it is no surprise that the earliest case of anesthesia provided by a nurse occurred during a time of war. It was during the Civil War in 1863 at the Battle of Bull Run when Catherine Lawrence first delivered anesthesia to soldiers using chloroform.
Grant that I may be worthy of the sacred pledge of my profession.
Anesthesia is the best job in the world. It's not really work if you love what you're doing.
In my eyes, there's really no greater honor than, saving the life of somebody who is willing to give their life for the country in the first place. And so our job is to be out there to prevent that from actually happening. So I think just being able to contribute to really salvaging these wounded warriors is the biggest reward.
What's your best thing about being a CRNA?
Taking care of soldiers, the 20 to 22-year-old who's in the middle of nowhere, alone, hurt, and we're able to provide them care within that golden hour to save their life, to resuscitate them, to get them through the surgical procedure, to stabilize them for an evacuation to Germany and then on to the United States. That has been the best feeling I've had in anesthesia.
And the lives of those entrusted to my care.
The nature of medical care in combat often provides only a brief interaction between the forward medical team and the service members they care for. Severely injured personnel are quickly evacuated to higher echelons of care. Follow-up with patients is not routine. Injured service members may never know who cared for them on the battlefield, and providers may never see the end result of their initial efforts. We followed up with CRNA Major Michael Bentley, who is currently the Assistant Director for the United States Army Graduate Program in Anesthesia Nursing at Fort Sam Houston, Texas, and PFC retired Tristan Wyatt, who is now the Deputy Director of the Prosthetics Department at the VA in San Diego, California. Their story begins in Iraq in 2003.
So it was about 10 in the morning, and it was hot. It was very hot, and we were, I forget what route it was, to be honest with you. It was in Fallujah, and we were basically doing route recon. I don't know if you're familiar with that or what it is or what it's become now, but you're basically just a target. And it worked. So I think we were ambushed by 30 or 40 insurgents. I guess they were insurgents and a mix of Iraqi official military. So we were going down a road that had fields on either side of it, and they basically had us in what's called a kill zone. They had 2 half moons around each side of the road. So, as a bunch of 19-year-olds would, we decided to stick around and duke it out with them. So we got into a gunfight. It was going our way for the most part. We were doing pretty good. And then one of their rocket teams snuck up behind us and shot a anti-tank rocket. It was called a light anti-tank rocket, and the thing hit me right in the knee. Couldn't fucking believe it. So it just took my leg off right there. It hit my buddy in the hip, came out his back, and then that same rocket hit my other friend right in the back of the leg.
I remember that day vividly. One of the few things that I can remember vividly nowadays. I was on call for any trauma that would come in that day at the 28th Cache. By this time, we were at Ivancina in the middle of the green zone. I was in my room waiting. I got the phone call to go down to the emergency room. We've got some casualties from a local, or not a local patrol, but one of our patrols. I come down into the emergency room and I immediately see 2 patients, one to the right of me and one to the left of me. One to the right of me had his leg totally removed. In fact, I believe it was disarticulated at the hip, and a hemostat was visible clamping the femoral artery. I didn't take care of that patient, but I did take care of Tristan. He was on the left. I could see his leg was traumatically amputated at about the thigh region. I could see the bone, I could see the flesh, and it was pretty intimidating, but I knew that he needed my help, right? So we established IV access. He was a little combative, understandably so. He more than likely lost a good amount of his blood. There was a tourniquet on. Proceeded to obtain his airway with the rapid sequence induction, and then we went right back to the OR so they could fix the wound and we could resuscitate him with blood. And if I remember correctly, he received almost, I believe, 16 units of blood that day.
A little while later, they invited me to a Fort Carson holiday, a Christmas ball. And I showed up there, and a few people had come up and mentioned that they were taking care of me while I was in Iraq. And I don't remember their names.
And unexpectedly, he was the guest speaker.
I was so floored to have met them that I completely forgot who they were. It was a very emotional experience. I don't know how often that actually happens, that people in the cash hospitals in the field reunite with the people that they took care of, especially during these catastrophic incidences. I can't imagine that happens all too often.
And every one of my colleagues that helped in his care, we were so glad he was there, and we cried like little babies when he told us about his recovery, going to Germany, then going to Walter Reed, and all the great care he received. And it's a nice thing to have those good stories in lieu of all of the bad stories you witness when you're over there.
Staff Sergeant retired Sam Silla was an infantryman serving in Iraq in 2005. This is his account of the day he was wounded.
You know, routine patrol on an area outside of Baghdad called Amaria. And July 4th, 2005, about 11:35 p.m. 3-vehicle section passed what appeared to be a bag of grain on the road, and we actually passed by it, and at one point I actually opened my door and looked at it from about 4 feet away. And we actually must have walked right on his position, and he detonated it. Big detonation, no damage to any vehicles, but shrapnel flew from my right side, ricocheted off my chest plate, sheared off most of my bicep, my tricep, cut my brachial artery about an inch from my heart, and then peppered my left side with good-sized shrapnel, hit the deck. And, my teammates really went to work that night.
My name is Michael Rushton. I was in the United States Air Force Reserves. I was medically separated in 2008 as an E5 Staff Sergeant. I remember that day very clearly. It was October, I think the 23rd of 2008. I had just finished work, had gone home and took a shower in a shower trailer, put my PTs on, left to go get some chow, walked down the steps of the shower trailer, and the alarms, the klaxons overhead went off for an indirect fire attack. There was kind of chaos amongst everybody. It turned out I was hit with a block of concrete in the lower back. I was in the emergency room and then in the intensive care unit at the Air Force Theater Hospital in Balad for 2 days, waiting for a medevac. I was medevaced to Germany and subsequently medevaced back to the United States. In the hospital, I was given morphine, Dilaudid, I guess kind of the real common painkillers to alleviate the migraine pain and the back pain. And my first interaction with a real pain management provider, if you will, ironically turned out to be CRNA.
Those who continue to practice the wartime anesthesia that this profession was founded upon remain a unique subset of the roughly 44,000 practicing CRNAs in the United States today. Military CRNAs practice in austere environments without the equipment and conveniences provided by a large fixed medical facility. In the deployed environment, CRNAs are not only the sole provider of anesthetic services at times, but they are responsible for maintaining their equipment, oxygen, and blood supply.
When I was with the FST in Afghanistan, we supported 3rd and 5th Special Forces Group, so we went forward on a lot of their missions as well. And it was just a small number of us from the team, 5 or 6 people, and we went with them there. But it would be surgeries in the field where if a patient needed an immediate intervention, like to clamp off a hemorrhaging artery, like an iliac artery or something, or like a femoral artery or something like that, you could do that there. Or if it was a tension pneumothorax, you could insert chest tubes out there. And that's the good thing with us is you can actually do that. You can make the call and insert a chest tube, which I don't think you would be doing in a cache, or certainly not in the civilian world. So
I'll be honest, we had an NCO who was great. Whenever we got a trauma, he'd initiate the whole blood drive. He knew where everyone was, and he had a protocol worked out with the FOB that they would, I don't even know how they did it. I guess they made an announcement over the loudspeaker. I was never outside. And people would come up and they'd just start giving blood. It was awesome. That was probably the best thing. Whole blood saved, anecdotally in my experience, whole blood saved more lives than anything else because it has everything you need, and it's warm.
Help me to offer hope and cheer in the hearts of men and my country.
I'll tell you what, by the time I got in the helicopter and I saw the crewmen and I knew what they were doing, I just kind of like relaxed and let everybody do what they needed to do, and I had supreme confidence that they would, take care of me, and they did.
I have no complaints. I mean, I'm alive to talk about it. So they, as far as I'm concerned, downrange, they were spot on. The one thing that I was most impressed with Walter Reed was the continuity and care that I had. From the time I came in, my orthopedic, my vascular guy, my doctors were the same doctors all the way through, right up until I medically retired out almost 4 years later.
We are CRNAs, but the 2 initials in between are the most important, and it's what we all are, nurses together.
For their faith inspires me to give the world and nursing my best.
We had to shoot our way all the way back to the base camp, which sucked. And as soon as I got out, I don't know, there was something about that guy. I was very confident that he knew what he was doing, so I kind of just laid down and let him do what he needed to do. I don't know what he was doing. It hurt like hell, though. I think he was picking stuff out of like my wound and stuff, and he tied a tourniquet on real good with a stick, and he pretty much had his shit squared away, that guy.
Instill in me the understanding and compassion of those who led the way.
Since the Civil War, nurses have continuously served as anesthesia providers. In 1917, Agatha Hodgins traveled to France during World War I to perform battlefield anesthesia. Another nurse anesthetist, Sophie Winton, served with the Army Nurse Corps in France using open-drop ether and chloroform techniques while assigned to Mobile Hospital 1. Because of nurses like Hodgins and Winton, the CRNA profession has grown significantly over the past 150 years. Nurse anesthesia providers have become an integral part of the military medical team, contributing to the leadership and advancement of military medicine. Medical providers may not fight on the front lines, but they selflessly risk their lives serving in hostile theaters of operation to care for their patients. They do not always make it home alive. CRNA Lieutenant Kenneth Shoemaker, who was assigned to the 67th EVAC Hospital, 55th Medical Group, the 44th Medical Brigade, is one of 2 nurses whose names are engraved on the wall of the Vietnam Memorial in Washington, D.C.
The most memorable event, though, during that deployment was having to take care of a Republican guard. Caring for him, he was being guarded. This guy was blown out of his shoes from an IED like 150 feet. What side you are in war depends on the politics of the country that you're at. That will label you friend or foe. not for me to judge. It is for me to try to save somebody's life if that's what I'm tasked to do.
In Afghanistan, we took care of 2 little girls on Christmas Day that were burned because we think they slept too close to the kerosene heater.
For I am thankful to you for giving me this life to live.
The Army's wartime medical mission is unique and can only be accomplished through tough, realistic training. Because of this, its anesthesia providers are trained through the country's most rigorous program to ensure they can operate independently. Autonomy and state-of-the-art training are essential whether the provider is assigned to a forward surgical team, combat support hospital, Joint Special Operations Commands, or to Crnas hospitals. This is the reason the United States Army graduate program in anesthesia nursing is ranked number 1 in the country by U.S. News and World Report's ranking of graduate schools.
We teach an attitude. We teach the fact that you may be downrange by yourself. We have to teach you to be autonomous when the time comes.
You're it. It's the reason why we train you guys the way we do. There's not a lot of civilian programs that train SRNAs to be as independent as we train you guys to be in the military.
And when they match you as an Army student to the civilian, there is no comparison. But you guys are the reason why we're number 1.
Today's military nurse anesthetists continue to make history. They function as standalone providers throughout healthcare institutions stateside and on foreign lands. On the battlefield, CRNAs facilitate immediate damage control surgeries. On aeromedical evacuation teams, they contribute to the fastest evacuation times ever and to the highest survival rates of any war. The tangible result is that more of America's warriors come home to their families.
Colonel Mildred Irene Clark is the author of the Army Nurse Corps Prayer. She served as a nurse anesthetist in the Army Nurse Corps during World War II and aided UN forces during the Korean War. She served as one of 2 CRNAs assigned to Schofield Barracks, Hawaii, and was present for the bombing of Pearl Harbor. She stood up the first CRNA master's program associated with an accredited university and was the first certified registered nurse anesthetist to become the chief of the Army Nurse Corps.